So thank you everybody for being here. I appreciate all of you joining me. It's great to be with all of you. It has been nearly 7 months since Dr. Levine and I announced the first COVID-19 positive case in Pennsylvania. And if you recall, this is back when March 6th, I think, when we started, we were really working with very limited information and equally limited resources. We were forced to take drastic measures at that time to buy time, to stop the virus, to do what we could. And in the spring, as a result of these draconian measures, we asked people to stay at home. We closed businesses, closed schools. And we did that because the only thing we knew at that point was the virus seemed to like it when people got together. And we looked at Italy, we looked at New York, we looked at places around the country, and we didn't want to have our health system be overwhelmed. And so we took dramatic action. And it worked. Pennsylvanians, I think, 13 million Pennsylvanians worked together, and we actually flattened the curve and I think did a pretty good job, especially in relationship to our neighbors to the east and the northeast. We kept our hospitals from being overwhelmed, and according to a study recently by the University of Pittsburgh, we saved thousands of lives. I think a few months ago, Drexel University said we saved 7,000 lives just here in the Philadelphia area by doing that. But by taking those drastic steps early and decisively, it gave us time we needed to prepare better and learn more about COVID-19. I think do a better job in the fight. It gave us the time we needed to increase our knowledge, gave us the time we needed to expand our resources, so that when we began to reopen the Commonwealth, we could do so in a relatively safe manner. In recent months, actually for the last 3 months, we haven't had a stay-at-home order. We haven't had a business closure order. And that's because we developed the tools we needed to track and contain the COVID-19 outbreaks in the Commonwealth. I was in Middletown, Pennsylvania yesterday, and I spoke about how Pennsylvania businesses stepped up to help us procure and distribute personal protective equipment. As a result of what we've done, I know there's some states that have actually not taken this time to build up reserves. And on a call yesterday, I think we heard from the federal government that they're looking at states that have gotten 1 month supply in hand, and they give them pretty good marks. They even give better marks to states that have done 2 months or more. And most of the states are in that category, either 1 month or 2 months. We have about 6 months stock on hand. So we're well ahead of not only the average, but well ahead of everybody else. In terms of the case count per 100,000, I think we're 42nd out of 50. So we're almost eighth from the best in the country in terms of cases. And our positivity rate is still slightly below 5. And our hospitalization rate has actually been dropping. So we're doing a pretty good job here, and that's a good thing coming into a period when colleges and universities are coming back, and we're coming, although it doesn't seem like it exactly today, the cooler period of the year. So this is a good thing. We have the ability to do more tests now. Our average is around 23,000 tests, just under 23,000 tests if you take the trailing 30-day average, but we're up to the highest day is over 30,000 tests in 1 day. And that doesn't count, that's if you add the antibody tests, antigen tests, we're even better than that. But just without that, we're still in pretty good shape. So any Pennsylvanian who wants to get a test can get one. We also have 1,500 contact tracers working in the Commonwealth, and we'll continue to do everything we can to expand their ranks. So while we've made all these preparations, we continue reviewing new research on the virus and we continue to investigate innovative ways to slow and stop these outbreaks. The last 7 months, this period has shown us that we're most successful when we all work together. We recognize that we're not fighting regulations, we're not fighting politicians, we're fighting a virus. All of us. I don't care if you're a Republican or a Democrat, a conservative or a liberal, that virus is out to get us. And we need to make sure that we're doing what we can. And so today, Dr. Levine and I are proud to announce the launch of a mobile app, COVID-19 Alert PA, which is a mobile app that you can use to fight the COVID-19 virus every day. It's an app that uses Bluetooth technology to help identify individuals who may have been in close contact with someone else who tested positive for the COVID-19 virus. Unlike traditional contact tracing, however, it does not require you to know the person you might have come in contact with. Now, if two people who have this app on their phones come in close contact with one another, say on a bus or on a subway or in a restaurant or at a store, and one of these people later tests positive for COVID-19, contact the Department of Health, this app will be able to anonymously notify the other person of their potential exposure. This technology supports our traditional contact tracing efforts by notifying more people at a faster rate. Right now, we get people who call up, say they've been in contact with somebody who has been in contact with somebody who had the virus. We then go around and call people, but we get about a 70%, 75% people who call back or pick up the phone. So this should be a little better in terms of just saying, okay, hey, we don't have to actually pick up the phone. You don't have to pick up the phone. It's just you get notified that you've been close to someone who has been in contact with somebody who has the disease. So we're going to continue to invest in additional resources and technologies. We think this one is a good one. The virus is not done yet. We need to take advantage of all the best tools to make sure that Pennsylvanians stay healthy. Downloading this app, this is for all of you, is really an important step that you can take, and I encourage you to take it today. If you just take a look at your phone, if it's an Apple phone, go to the App Store. Now, this is really brand new, so if you do a search on the App Store, it may not show up COVID-19 PA, COVID Alert PA. COVID Alert DE is in there, and Delaware has already signed up. In the next couple of weeks, we think New Jersey and New York are scheduled to sign on as well. So we have a bigger and bigger network. It is easy, it's free to sign up. So just download it today, and I think this is going to be a real big step for all of us in Pennsylvania in terms of helping to move us toward a better way of dealing with this disease. So with that in mind, my privilege to call on the famous Pennsylvania Secretary of the Department of Health, Dr. Rachel Levine.
Thank you. Thank you, Governor. I don't know about famous, but thank you so much. And thank you so much for your leadership on this effort and really throughout the COVID-19 pandemic. As the Governor said, COVID Alert PA is an innovative new tool in the fight against COVID-19. It takes one thing that we really never leave at home without, which is our phone, and helps us use it to protect yourself and others from this very contagious virus. This app and the exposure notification technology created by Apple and Google strengthens our response to the pandemic by uniting our smartphones together in the fight against COVID-19. This app was created through a collaboration with a number of partners that I would like to take a minute to recognize. First, our team at the Pennsylvania Department of Health, under the leadership of our Deputy Secretary for Health Innovation, Meghna Patel. Nearform, which is the app developer. The University of Pennsylvania's Center for Health Incentives and Behavioral Economics, and MIT's Lincoln Laboratory, Computer Science and Artificial Intelligence Laboratory, and Internet Privacy Research Institute. And finally, surrounding states such as Delaware, who launched COVID Alert Delaware, or COVID Alert DE, just last week. And as the Governor mentioned at the beginning of October, that will include New York and New Jersey. So what does COVID Alert PA do to help us in this fight? COVID Alert PA helps notify you if you have been in close contact with a person who later tests positive for COVID-19. And we have built in additional features to help you stay up to date on the latest data on the pandemic. It also helps keep track of how you're feeling each day and connects you to resources if you need help. So here's how. If you get a notification on your phone that you have come into contact with someone who has tested positive for COVID-19, you can choose to send us your phone number to get a call back from someone on our team to speak with you about how you are feeling and whether or not you should be tested. You can use the symptom check-in on the app to help remember how you've been feeling and whether or not you might have symptoms that are consistent with COVID-19. And you can find testing locations if you need to be tested. Now, when you receive, or if you receive, an exposure alert, we actually, as the governor said, will not be able to tell you who you came into contact with that tested positive. It is anonymous. Apple and Google were very specific when building this technology to ensure that your privacy is protected. We won't know who has downloaded the app, who has received notifications, and who has used the symptom check-in. We cannot track that information. This app puts the control in your hands, and you determine how much, if any, information you share. In addition, the app does not, and I repeat, does not track your location. It does not use GPS or other location services on your phone the way a navigation app would do, or even a shopping app would do. It does not track your location. COVID Alert uses the same Bluetooth technology that your phone uses to connect to your car or to your earbuds or earphones. These items also do not track your location, but allow for a connection when the phone is close to them. It's up to you whether or not you decide to enter any information into the app. The app will work the way it's supposed to without collecting any of your personal information. It's up to you. There is one other benefit to the app because other states, again like Delaware, are also using a similar app, and COVID Alert PA will work if you travel to Delaware. So if you live here in Philadelphia, but you travel to Wilmington to work or vice versa, your app will work there too. So if you live in Wilmington and work here in Philadelphia, again, COVID Alert Delaware will work here. This interconnectivity is very important because it gives us one more tool in our toolbox to travel safely. So here's my message today. If you are 18 or older, you have to be 18 and older to download the app. Please download COVID Alert PA from the Apple or Google stores today. It works on Apple and Android phones. Make your phone part of the fight in a united against COVID-19, because that's the way we're going to defeat this virus, united together. And as always, stay calm, stay alert, and stay safe. Now, for reporters who have very specific technical questions on the app, we are actually having a technical phone call today with our team and Nearform's team and others at 3 p.m., right at the end of this press conference. So please contact our communications office for more information, and we have communications staff here as well that can tell you how to connect. But if you're going to ask very, very technical questions, I probably won't know the answer, but they will if you call in at 3 p.m. So it is now my pleasure to introduce my friend and colleague, the Commissioner of the Philadelphia Department of Public Health, Dr. Tom Farley.
Thank you very much. First, I want to thank the governor and Dr. Levine for working so collaboratively with the Philadelphia Health Department and taking such strong action that it really protected this city from this terrible epidemic. It's been a great partnership and an effective partnership all through this period. Overall, we've made great progress against COVID-19, but it's clear the epidemic isn't over yet, not by a long shot. We need every tool we can get to combat the epidemic. We need better treatments, we need better vaccines, and we need better information technology. That's what today's about. If we can reduce the number of people that each infected person passes the infection onto, then we can more rapidly reduce the overall rates of infection in the community. That's our goal here. So right now, we try to do that in the Philadelphia Health Department through contact tracing. The way that works is if someone has the infection, they'll get a phone call from one of our workers to find out who that they may have exposed, find out who they may have been exposed, and then our worker calls those people, we refer to as contacts, to tell them they should go in quarantine. It's a good process, but it is not a perfect process. Many of the people who we interview don't know the names or don't know the phone numbers of the people that they may have exposed. Some of them may know them, but they may be reluctant to tell us of those names. And some people that they've exposed, we simply can't reach. We can't get them on the telephone. This app can fill in those gaps. It sends messages to people who are not known by or not named by the person with the infection. And then people then receiving the messages then can take steps to protect their own health and protect the health of their family. But you know, it only works to the extent that people use it, to the extent that people download it and activate it. So I want to add my encouragement to what Dr. Levine just said. Recommend that people do that. If you download and activate this app, it will help protect you and your family. It'll let you know if you ought to quarantine because you might have been exposed, and if you need testing. So I want to encourage everyone here who has a smartphone to do that right now, to download the app. Now, the tool should be especially effective at colleges and universities. These are where outbreaks are occurring right now across the state and across the nation, and where I'm hopeful that we can get the entire campus to buy into this, to download and activate the app. So I want to especially encourage students, faculty, staff, anyone associated with the university to download and activate the app right now. I should say I have already done that. It's very easy to do. I'm excited to have it there. I'm hopeful I never get an exposure, but if I do get an exposure notification, I know what to do. With that, now I want to turn it over to Luz Colon, who is the Executive Director of the Governor's Commission on Latino Affairs.
It is my honor to share my remarks to the Latino community statewide in Spanish. Es un honor estar aquí con ustedes para informarles de una aplicación que tenemos disponible que se llama COVID Alert PA. Esta aplicación COVID Alert PA es un proceso de identificación y evaluación y a manejo de personas que han estado con enfermedad para prevenir una mayor transmisión. Cuando se usa manera constante, el aseguramiento de contactos ayudará a romper la cadena de transmisión de COVID-19 y es una herramienta de salud pública para enseñar y controlar el virus. La Comisión Asesora del Gobernador sobre Asuntos Latinos estamos comprometidos a compartir los recursos con la comunidad latina. También tenemos el privilegio de trabajar con cada departamento del Estado para ayudar a garantizar traducciones en español y los servicios para toda la comunidad. Esta aplicación, COVID Alert PA, es un verdadero testimonio del trabajo y de la dedicación que tenemos para prevenir este virus. Les animo a todos que siguen a sacar sus teléfonos y aplique a esta aplicación en su móvil para todas las alertas del aseguramiento contactos. Estamos llegando a nuestra comunidad latina durante esta pandemia para unirnos y hacer un esfuerzo para seguir hacia adelante y a saludable. Aquí de mi parte y gracias a ustedes por estar aquí hoy. Y ahora tenemos el gobernador Tom Wolf. Right now, I would like to bring to the podium Governor Tom Wolf. Thank you.
So any of us will be happy to take questions, and as Dr. Levine said, the technical questions will be answered in just a few minutes. 3 p.m. on the phone. Okay, yes. Hi.
I'm going to shout, but I'm not shouting at you. It's just so you
I
can
got
hear
it.
me.
Yeah.
My question is, today they're reporting just overall nationally that there's 200,000 in regards to the death toll
Right.
across the country. So you just were talking about how the numbers are pretty good in Pennsylvania. I'm wondering if this app, in combination with other things, is anticipation of a surge that you may or may not be expecting coming in the next couple months.
Yeah, well, first of all, one death is awful, but you're right. 200,000 in the United States is something. I think the death toll in Pennsylvania is now just around 8,000, and that's entirely too many. We've seen a nice decline in that rate as we've learned more about the disease, and I think as we move forward, there are a number of things that we can do. One is wearing a mask. Another is practicing social distancing. If you don't have to go out, if you don't have to be in a crowd, don't do it. But this contact tracing and testing will definitely help as we move forward. Obviously, everybody's waiting for a vaccine, but even when that comes, I think we're still going to have to be exercising care and responsibility as to how we interact with each other. So the hope is that this helps. It's one more thing in the fight against the COVID-19 as we get to a point that might be an upsurge, cooler weather, colleges and universities coming back together. But we know more now than we did, and I think we're in a position to do a better job now than we were back in early March.
But are you anticipating a surge? Like today, Minnesota is another state right now that is already seeing an issue. Is that something that right now?
But I don't know what to say. We're preparing. We've been preparing all along for a second surge. Actually, this would be a third. You know, we had a small upsurge in June, July, and that led to some targeted efforts on restaurants and bars that I think was recommended actually by the federal government and actually had a good effect on Pennsylvania. We're seeing a slight upsurge, a little, not much, but a little bit of an uptick in cases right now from where they were, say, 2 or 3 weeks ago. I think that's fair. We're seeing, just some activity, and again, we're looking we're looking toward cooler weather and the flu season. So we're preparing for that. We've built up inventories of PPE. We keep checking every day as to what the capacity is of our healthcare system in terms of intensive care unit beds for adults and children. We're doing all these things to try to make sure that when and if something does happen, we're prepared. Obviously, the hope is that it doesn't happen. Yeah. Oh, sorry. So I'll get that. Go ahead. Go ahead.
Okay, can you explain a little bit more how the app works when it comes to the Bluetooth? Like, does the Bluetooth connect to the other phones around it? How are they tracking without tracking location?
Are you doing this just to trap me into something? I mean, I'm not a technical person. All I know is that you download it from the App Store. It uses Bluetooth technology, which basically allows you to know if you're in close proximity with somebody who might have been in proximity to somebody who has the disease, but it does not tell you who it is. If you had a GPS system, that system could presumably come back and say, well, you were here and you were there, and that's where it happened, so now we know a little more about the two of you. This doesn't have this. Just knows, it tells you that at some point you got in contact with somebody who said they were in contact with somebody who had it. You might want to call the Department of Health and find out what to do next.
Okay, thanks. Governor, you talked about some of the measures that you took given the court ruling that was against, that struck down some of the restrictions you put in place. How concerned are you that people in Pennsylvania just won't listen to what you are telling them to do now that some of your restrictions have been struck down?
Yeah, the two big ones were the stay-at-home order and the business closures, which we haven't used for months. I mean, businesses are open.
The gatherings as well.
That was the one thing that's right, the size of the outside gatherings. Now, I think the question that we all have to ask ourselves is, can anybody wave a magic wand, pass a law, issue an edict that says, you can just go ahead and do anything you want and sort of disregard the virus? And I think the answer that the people of Pennsylvania gave is, no, we're not going to disregard that. I checked over the weekend, The ruling went into effect before Friday night football games. And over the weekend, there are very few schools, if any, that had, big crowds at their events. And I think that's because people just decided, I don't care what the court said, I don't care what the legislature said, I don't care what Tom Wolf says. That virus is out to get me. I'm going to try to figure out what that virus is thinking, and I'm going to try to do everything I can to counter that virus. And so I think regardless of what a judge rules or regardless of what a General Assembly does or a governor does, people in Pennsylvania have shown that they don't want to get this disease, and they're going to do a lot of things like wearing masks. They're going to do a lot of things like practicing social distancing and staying away from crowds. So 250, yeah, I mean, that is an arbitrary number, but I think we have to acknowledge that, I mean, in Ontario, Canada, I think they have 10 as their top. Who knows? All we do know is that virus really likes it when people get together, and the less we do that, the better we're going to be.
On that same issue, President Trump is going to be in Pennsylvania, in Pittsburgh, today.
Yes.
He previously had an event in the state of Pennsylvania where there appeared to be hundreds of people.
Right.
How are you going to prevent that from happening again? And if you can't, then if there are no consequences, why not just do it?
First of all, we sent a letter to the White House saying, if you have more than 250 people, that'd be a violation of our law. Interestingly enough, we never heard back from the campaign. If they have an event, as they apparently are planning to do, I'm sure the president's going to do everything in his power to keep the people, his supporters, safe.
Are there any consequences if there are too many people and no masks?
We haven't decided at this point. Yeah.
After the Latrobe rally on September 3rd, did you guys see an increase in cases at all in that area?
After the what?
The rally that President Trump had at the beginning of this month. Did you see an increase in cases after that in that area?
We haven't seen any.
It's too soon to really tell, but
Okay.
nothing going on.
Too soon to tell.
Okay. And then how many people per 100,000 are being tested in the state right now? Coronavirus Tracker says that Pennsylvania is doing about 95 per 100,000, but New Jersey's doing about 240. Is there a more updated number, and why is there such a large difference in this?
You want to take this?
So if I'm remembering the statistics, we're well over 1,000 per 100,000 tests. We are the last time we look, and it is challenging to compare with other states, that we were about 36th or 37th in the country. If you look at the Johns Hopkins study that was published a number of weeks ago, it depends on if you're reporting how many tests were done or how many people were done. In the past, we were reporting how many people. They're recording how many tests, and some people have to get tested a number of different times. So we are slightly less than average for the states, but I think that we are continuing to increase our testing. We're particularly working on increasing our antigen testing. Those are not counted in many of the statistics, just the PCR testing. But the rapid point-of-care antigen tests, many are being sent, for instance, to nursing homes and other facilities by CMS and the federal government. They're also going to be sending out to the states 150 million Abbott Binex cards for antigen testing. Those aren't included when you look at some of those statistics. So I think that we certainly want PCR testing, which is the gold standard, but these rapid point-of-care antigen tests are going to be very useful. So I think that whenever you're looking at those statistics and you're comparing state to state, sometimes it's apple and oranges. I think we're doing really well with testing, and we need to do even better with testing, and we're working on a number of different ways to expand our testing. I mean, that is part of our containment strategy. You test, those that are positive isolate, you do contact tracing. That's why we're here today, because of this big advance in contact tracing. Those that have been in contact quarantine. It's a very important part of our strategy.
Yes. Back there, if the red hat is next.
So Apple and Android already have their own version of exposure notification. How do those differ from this like state app, and is one better than the others?
I think that sounds like a question you might want to ask at 3 o'clock. I'm not trying to dodge the question. I don't know. This is an Apple and Google.
It's made by Earphone, a different company, but it's working with Apple and Google.
So they're working with Apple and Google. Go ahead. Yeah.
So this is a specific app made by that company, but it is working very closely with Apple and Google as well. I can't tell you the technical differences between this and some of the other apps, but they probably can at 3 o'clock. And we've been working on this for months, so this was not in particular for this period of time. It's just to work with all these companies and to get the technology right takes time.
I think back.
Governor Wolf, just going back to the federal ruling this morning, what is, from a legal perspective, what's the state's next move? Are you going to continue with this appeal?
Yeah, I think you're talking about the Western District. The Attorney General applied for a stay, and that was denied. So we'll move ahead with an appeal to the Third Circuit. Yeah.
Dr. Farley had mentioned that this app, you were hoping that college campuses would be part of it. Right now, it looks like in Pennsylvania, the increases are in Center and Indiana County.
Right.
Separately, Jersey, Gloucester County, which is a Rowan University. So right now, was that top on your mind? Is
Yes.
that on your mind right now? And,
Yeah.
and tell me how you are.
We actually, it's been on our mind for a couple of weeks now. Deborah Birx actually came up to Pennsylvania, and she shared with us that that's a concern of hers at the federal level as well. As colleges and universities come back, one of the areas of concern is in colleges. And we have found, in fact, here in Pennsylvania, that the hot spots are, in fact, where there are universities. You mentioned Center County, Penn State, Indiana County, Indiana University. Another one is Union County, Bucknell, Columbia County, which is where Bloomsburg is. So there are outbreaks. I think we've had an outbreak, an upsurge in one county that has not been associated with colleges, universities, and that's my own, York County, which has been the health system and the York County prison. But yeah, it's a concern. And again, it's what else? The virus loves it when people get close together, and that's what you do when you're in college. You're close together. I'm sorry. Yeah, go ahead.
Address a little bit about the schools and sports and that issue. What are schools allowed to do at this point in terms of sports? What decisions can they make on their own right now?
They can make any decision. The only one that court overruled was the number 250 as a maximum. So again, the guidance is, be careful. It's sort of like anything else. When you get with other people, the more you do that, the closer contact you are. I just read something today that the longer the flight in an airplane, the more probable is that you're going to get the virus. So I think that right now the court simply ruled that having the 250 max is not constitutionally correct, and who knows what the right number is. All I know is that when you bring people together, the COVID virus finds it easier to infect other people. So schools, parents, teams have apparently taken that to heart. So over this past weekend, when that limit had been thrown out and they hadn't made a decision on a stay at that point, people still self-regulated. Said we're just not gonna show up, and so we didn't seem to have much of an issue.
So legally, this coming weekend, if they want to gather 500 people on a football field, that's okay.
I'm not a lawyer, but since the stay was turned down, it sounds like, at least for the moment, I guess that court ruling stands. We're working in the meantime to sort of present schools and others with guidance to say, okay, in our best estimation, from a health point of view, you ought to be careful when you get together. And if you get together in bigger and bigger numbers, you're leaving yourself open to bigger and bigger likelihood that you're going to catch the disease. I don't know, do you want to add anything to that?
Thank you, Governor. So when you said it's okay, I mean, it's not okay, because if you're going to have lots of people together, as the governor said, and they're not practicing social distancing, if they don't have masks on, if they're not using hand sanitizer, and you have groups of people congregating together, that's how you spread this virus. And that has been shown in a number of different national outbreaks. The Biogen conference in Boston in February turned out to be the super spreader event of the East Coast, and probably started the outbreak that we had in the spring. There was a wedding in Maine, which has led to well over 150 cases and 7, 8, 9 deaths because people weren't doing that. The South Dakota motorcycle rally has triggered events in South Dakota, which has one of the highest increases in the country. So it's not okay. There are consequences to people's actions. What this virus has certainly taught us is that we're all interconnected, and you can't avoid that. This is not a political issue. It's not a partisan issue. It's a public health issue. The virus is a biological entity. It's going to spread and reproduce. That's what it does. And so it's not okay. The other thing I think Dr. Farley wants to mention is the rules in Philadelphia, which are stricter than they are in the state.
Actually, but before you go, I just want to sort of circle back to what I had originally asked the governor about, now that we've sort of established that legally people can go ahead with those larger gatherings, though you're saying it's not okay because there are health consequences.
That's correct.
How worried are you about what the consequences could be health-wise if people do start having those larger gatherings now?
I worry all the time. We're very concerned. That's how the virus spreads, and that's how we see clusters and outbreaks. You were mentioning about college campuses. That is correct. The increases, as the governor said, that we have seen have because of college, of clustering in colleges and young people, 18 to 24, which are the biggest increases that we're seeing in the state, not practicing the safety measures that we just mentioned, and then there are consequences to that, and the virus spreads. And so what we did actually is we had what we call a C-REACT team that worked with Center County and State College and Penn State to try to develop some recommendations for them, and we'll be giving those recommendations to them this week. They went at the end of last week. It was virtual. So we are trying to contain and mitigate the spread of this virus. But I want Dr. Farley to talk about Philadelphia's regulations, which are different.
Yeah, so I also worry a lot about the gatherings, but just to be clear that the legal ruling had to do with the state orders, not with the city orders. So within the city of Philadelphia, competitions in contact sports between teams is prohibited, and gatherings of greater than 150 people is prohibited within the city of Philadelphia.
But again, I think we've got to remind ourselves that this is not about ruling from the bench. It's not about the General Assembly. It's about that virus. And as Dr. Levine said, we all ought to be trying to fight that virus, not each other. And as Tom said, as we work toward a solution for all this, as we keep looking forward to getting to the end of this pandemic, that ruling really only affected the state. So the local governments have always been able in Pennsylvania to be stricter than the state.
And as we mentioned earlier, the country has reached 200,000 deaths. Do you think this represents a failure by the Trump administration? And what do you think needs to happen to make sure the country can avoid reaching 300,000 deaths?
Well, all I can look at is our own experience. I think Dr. Levine has done a phenomenal job of providing guidance in Pennsylvania. And I think we've all done a good job of trying to make the case that I just made, that we're fighting this virus. We shouldn't be looking at fighting each other. I think one of the things that we've been able to do as a state is to really stockpile inventory of protective equipment, really track the capacity of our healthcare system, and do things like build testing capacity and mainly build the contact tracing capacity and look for innovative ways to track this disease. Those are the things we did here in Pennsylvania, and they worked. You know, we're one of the best states in the country in terms of the case count, in terms of positivity rate, in terms of hospitalization. We're doing very well. And if you had taken Pennsylvania and expanded that to the nation would be in a better place. I don't know if you describe that to leadership or just luck, but I think Pennsylvania's done a phenomenal job, and I think it's due to the people of Pennsylvania. All right, thank you very much. I think that's it. Thank you.